Welcome to AMSA's ExpodPod 2023, to exchanges and beyond. I'm Kai, your host for this season, and the ExchangePod or ExpodPod is premiering today during the AMSA week, which is filled with activities including a mental health forum and even a general assembly for AMSA members. The episodes for this year's ExpodPod will be brought to you by the Standing Committee on Professional Exchange, or SCOPE, the Asian Medical Students Exchange Program, or AMSAP, and of course, the Standing Committee on Research Exchange, or SCORE. However, today it will be all about SCOPE, so make sure to catch SCORE and AMSAP's episodes in the following days. More about ExpodPod, it's all episodes about exchanges, the what, when, and hows, and the experiences of our speakers, as well as their learnings. So grab your favorite comfort food or drink and get cozy as you listen and learn from today's episode. All right, so let's begin with SCOPE. And with me today is SCOPE's Deputy Officer on Logistics, Francis.
Hello.
And we also have our one and only SCOPE Local Exchange Officer of AMSA-UST, Shannon.
Hi, everyone.
Okay, but before anything else, of course, I'm sure everyone wants to know. So Ate Shannon, can you tell us a little more about your committee, SCOPE?
Sure, Kai. So SCOPE stands for Standing Committee on Professional Exchange. We encourage openness to learning experiences beyond the four walls of medical school, as well as appreciation for different cultures. So here we aim to provide medical students, particularly our clinical clerks, an opportunity to experience clerkship in another country through the professional exchange program. So by being delegates to this professional exchange program, we hope that their experiences would help them become holistic physicians with globally competitive skills and a better understanding of people from all around the world.
Thank you for that, Shannon. But wait, let us not forget our guest for today's episode. He had previously participated as a delegate of the Professional Exchange Program. He's AMSA-UST's former president back in the years 2016 to 2017, and also AMSA Philippines' former president in 2017 to 2018. He graduated from the UST Faculty of Medicine and Surgery in 2018 and is now a practicing doctor. Let us welcome Dr. Ramon King.
Hi, good morning, everyone. Thank you for inviting me here.
We're really, really glad to have you on this podcast. So how are you feeling today, Doc?
Still a bit sleepy. I'm having my coffee right now.
Okay. So
But I'm doing good. I'm doing good.
Okay, that's very great to hear. We're genuinely excited to hear about the things and experiences you have to share. So we know that you were a previous delegate. Can you tell us what made you decide to join SCOPE's exchange program, or maybe tell us how it all started?
All right. So to be perfectly honest, I did not initially apply for the SCOPE program. I did not plan on going on the exchange. What actually happened in my situation was my friend who wanted to go to Japan for her SCOPE applied, did all the process, she did all the work, to be honest, but then she, in the last minute, wasn't able to go, so she offered it to me. So I kind of inherited her work. So I was just lucky enough to go to enter the SCOPE program through that way. But then, I did have a lot of experience talking to everyone else who did the SCOPE program by the book. And I can tell you, it's a lot of work. And but I'm really glad I did end up here, and I ended up going to Japan for my SCOPE. So that's a little background of my experience for the SCOPE program.
Oh, so I think it was kind of unexpected for you. But can you tell us
very much
more?
so.
Can you tell us more about how you prepared for your application?
Yeah, sure. Okay, so, well, for the application, I guess aside from submitting your documents, um, obviously per institution, there's going to be a different set of documents that you would need and prepare. Aside from the usual, your passport, IDs, etc., your your transcript of records. I think the ongoing transcript of records that you have as a student during that time, you have to ask it from the dean's office. Um, Another important thing that came with going to Japan was that you needed to prove that you spoke English. I forgot the exact thing that's called, but you need a document saying that you were proficient in English in some way. Others would need to take a short program to answer the exam and say yes that based on this short program we have a certificate saying I do understand and I am proficient in English. But I remember in my case or in the cases of during my batch, we were able to ask a letter from I think from the dean's office, and they were able to like just vouch for us that yes, we do speak English. So that's another thing that I think you guys should consider when you're thinking about or you're planning to join the Scopy program would be what country you're applying to, and especially what language you're speaking and what kind of requirements that they would have. Yeah, the language barrier is a real thing. Can be very difficult to get over. But syempre, if that's what you guys are after, right, it really depends. But it'll all be worth it naman. I think that's that's the biggest hurdle that most of us had to go through with that language proficiency test or certificate because we did not know how to go about it before. Others paid for like a program, a day course just to get that certificate. Pero buti na lang kami, we didn't have to do that.
It's nice that
But
you
yeah,
pointed out the importance of someone's English proficiency and as well as the struggles of communicating with foreign people because of the language barrier. Doc, can you tell us what do you think sets you apart from the other applicants for this exchange program?
well, obviously when I went for the exchange program, I was already a AMSA officer at the time. I was the president. Um, Actually, no, I was the past president by the time because I was in clerkship. So I was the president of AMSA Philippines when I went to my exchange. And actually, throughout my entire time in AMSA, I did not participate in any exchange whatsoever of me going abroad mismo. But I participated a lot in the exchanges of the delegates who would come over to the Philippines, and I would help out touring them a lot, you know, catching them from the airport. So I'm not sure if the AMSA currently has a point system because back then you would have to quote unquote kind of earn the points. You know, this guy worked more in this guy worked more in the exchange program. Should be more eligible to go abroad. You know, for him naman to enjoy, for him to have the person experience. You know, all those things. So I did somewhat have an edge that I was an officer. Siyempre, as an officer, you're entailed to do a lot of work generally for your organization. And I did participate a lot in the exchanges, and I did participate. I did, you know, have a lot of interaction with the delegates. But something that I did not do, which was pretty commonplace at the time, was others would actually adopt a delegate. I don't know if they still do that now, ever since the pandemic. But back then, uh, delegates would really delegates who come to the Philippines would just live with a random med student in their dormitory or in their house with their family. That's something I never did. But everything else I kind of did. Yeah.
Okay, thank you, Doc, for the answer. So, essentially, in your opinion, do you think that being an active AMSA member matters when you're applying, or does it benefit the applicant who wishes to go on this exchange?
Oh yeah, most definitely. So being an active AMSA member, uh, of course, especially if you guys still have that point system involved, you know, um, it would kind of earn you the slot to get you in the program, especially back in my time. At the same time, because when you're more, I guess if you have more interaction dealing with other delegates, you kind of have a good, it's kind of like a taste or like a preview of what it will be like being an exchange student as well when you yourself go abroad. um, you kind of understand what they're going through, what you can expect, and you handle that same challenge for yourself. That you're going to go to a foreign place. You might be alone. You might not know who you're going to live with. You know, there are those anxieties and some worries that by participating in the AMSA projects here in the Philippines, you kind of have more of an idea of how uh, what they go through, diba? So yeah, it's definitely going to help.
So it's really going to give delegates, I guess, like the experience of being able to connect with others, which is going to benefit them when they do the exchange.
Yes, definitely.
So yeah. Okay, thank you, Doc. So with this, what advice can you give to those students who are interested in applying?
Okay, so some advice aside from the fact that I advise you guys to be active in the organization. Um, Once you guys have decided that you are sure that I think the exchange is for me. I want to experience the exchange. Um, I would advise you guys to actively research on not just the country you guys are planning to go to, but the specific hospital or institution that you plan to apply to. Because, like for me, for example, I went to a hospital called um, Toho, Toho University in Tokyo. So it's also not like in the heart of Tokyo, like what you think of, like how you imagine Tokyo to be, like a big bustling city. Where I ended up was in a institution pretty far, like at the edge of Tokyo, which is kind of near the provincial side already as well. And at the same time, the time I was going there was February, which was like the coldest season as well. So everything I had to prepare for. I actually got hives. I got eczema by going there. Um, because it was way too dry. So I actually had to go through like a couple of weeks trying to look for moisturizer in Japan because they didn't understand me, even with the Google Translate for some reason. So, those are, especially, for example, you have certain skin conditions or any kind of condition. Maybe you have like a cold induced asthma. Think about the place that you're going to, the geography, all of those things matter. Um, and of course, as I said earlier, think about the language barrier, the kind of specialty that you want. Like, for example, a lot of those back then who wanted to go to Japan because they had really good technology in terms of surgical procedures, like microsurgeries, especially like neurosurgeries, etc., etc. So, if that was your goal, then you wouldn't really need so much like language to facilitate your learning. You had to observe. So just by being there, you could see their technique, you could see how it's done, you have an idea. That's kind of, you're already enriching yourself through that experience alone. I, for example, I knew about this, but I still kind of proceeded with entering general slash internal medicine in Japan, which is, you could expect, would entail a lot of communication, like literally talking to your patient. I did end up in the OPD a lot with my consultant, with my junior consultant there. And yeah, I was lost probably like 95% of the time. But my consultant was just really, really nice enough to translate what transpired between him and the patient. But I don't think everyone will be as lucky as me in terms of that. But then I did experience a lot of other things aside from that, the OPD sessions. I read ECGs. with my consultant. I saw their endoscopies. There's a lot as well. It's not just if even if there's a language barrier, there's still a lot of other things that you can do. But yes, it is something to really consider as well. Like what kind of specialty or what kind of rotation are you planning in the other country that you're planning to go to?
Okay, thank you, Doc, for mentioning. Of course, there's a lot of adjustments when it comes to going to different country, like you mentioned with hives and everything, and of course the language barrier. But of course, our listeners want to know a little bit more. Can you tell us what your experience was like as an exchange student in terms of challenges that you faced during your exchange and how it is a little bit different, I guess, in terms of like from the application to the actual clerkship when you were already there?
Oh, okay. Um, I guess the biggest challenge really is just navigating yourself and being alone. Actually, okay. I would call it a challenge, but at the same time, I guess it was kind of the most fun I've had because I entered my exchange alone. Others would go with like one or two friends. They would be lucky enough to be accepted in the institution together, but I was alone. So I was basically in another country with a different language by myself for 30 days or so, which is a pretty big thing. I've never experienced this in my life. I was never this far away from home alone for this long. Of course, you're scared. Anything can happen, right? You could lose a passport. You could get mugged. You could whatever. You could get lost. You could get an injury. All these things are possible, and you don't have any family or friends, or even speak your usual language and be understood. Of course, I that was like a big fear that I had to go through at the time. But at the same time, because I had to do that, I kind of had to learn. I had to kind of like grow up. I had to mature. I had to learn how to do these myself. So yes, it was a big challenge, but I'm really glad that I went through with it because I had to plan like my day, like where I'm gonna eat, where I'm gonna go. Like there's no one else I can depend on except myself. Um, I think those are, and I think the hardest part literally was taking the subway because yes, there are some English translations in the signs, but at the same time, other times there would be none. And then sometimes I would just follow the group of people, like going from one train to another, and I find out that they are not the same destination as I'm going to. So I did end up getting lost a couple of times. Um, so what I did learn was Google Maps is really, really good. Like Google Maps would know exactly what train to get off from, what train to enter, the name of the train, and they even have the Japanese characters in Google Maps. You can just like look at the same Japanese characters, then that's probably the same train that it's telling you to go into. So they would even tell you the best route to pass through. So once I had Google Maps, I was kind of set. But the first couple of days, first week, I didn't know how to use Google Maps that well yet. I was pretty lost, and I did get lost a couple of times. But it was kind of fun. I'm not gonna lie, I did enjoy it. So yeah, I think that's the biggest barrier, the biggest difficulty I had. Um, Others you would think about like your work in the hospital. I don't think they're going to like generally. I don't think they're going to expect you to do much because they know you're just there for observership. Um, from what I can tell, majority of my friends who underwent the same program, they didn't do much. They were just there to basically observe and enjoy, have fun. You're there for your own learnings. So the more you involve yourself, the more you're going to learn and get out of things and get out of the program. So not much stress at work. I guess the biggest stress would be getting to work, on time, making sure that um, because you are kind of like the representative of the Philippines, you kind of represent the Philippine Med School. So you don't want to be late. You don't want to look unhygienic. You want to look good. You want to look presentable. You want to be respectful. All those things because you're representing the Philippines. You can't if you are rude, you don't come to work. They're going to leave a bad taste in their mouth, and they might not want to accept exchanges. Those things can happen, especially with bad behavior. You don't want that. Um, they do receive reviews, and then especially like the Scopy officers back then would communicate a lot with each other. Oh, we have problems with this person, blah 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 blah. So please avoid that. So that's, I guess, this another stressful thing that you just have to do your part, a very minimal part, but you just have to do your part. And I guess just put your best foot forward, especially when dealing with um, the other institution. Yeah, I think that's about it. Among the challenges I had to face.
So you definitely learned a lot about yourself, Doc, being abroad and doing this exchange, and as well as there's that pressure. You're carrying not only UST Med's name, but also Philippines, like Philippine med schools, as you mentioned. So playing off of that, what did you learn from your experience as an exchange student, this time in the context of medicine and like in Japan and their healthcare system?
Oh, okay. So that was my first experience in a what you call um sorry, the word is escaping me right now. The universal healthcare kind of system where they all go back to the general practitioner. That's the first time I really encountered that firsthand because, well, I entered internal medicine in Japan as rotation, but their internal medicine is somewhat grouped together with general practitioner and general medicine because their internal medicine would also handle a lot of GP or general like family med stuff like psychiatry problems like depression. They would also handle some minimal OB problems, not so much pedia, but kasi diba dito, if you say IM, wala na yung OB, wala na yung psych, wala na yung blah 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 blah. They are still somewhat the general practitioner of the hospital. So I would see that once another specialty has um seen them, they would go back to the IM or Gen Med, and then they would be the ones to follow them up and make sure that they are doing the surgeon's orders, recommendations. Um, it was a pretty good system. Um, and parang people did get, they parang, the way my consultant would explain it to me was that people in Japan were taken care of so well in a way is that to the point that they would go to the hospital for mundane problems na lang. Like, uh, like they were, like majority of the patients that you would see have barely any real medical issue. Like, they were kind of there just to use up their insurance para hindi lang masayang. Because they generally have good access to healthcare. A lot of them, did not need to. A lot of them would already their medical problems would already be seen during the screening, and they'd be able to treat them prophylactically. And the rest that you would see a lot in the OPD were kind of just, I just feel kind of unwell, just want us to have this check. They're all kind of mundane problems. So, but at the same time, my consultant did bring up the issue that because there are a lot of people now just going to the hospital for mundane problems, those with more medical emergencies, with actual medical problems, sometimes would be pushed to the back because they're not screened as well sometimes because they're other people would kind of blow up their own symptoms, make it seem like they have more problems. Then those actual medical problems would not be seen as soon as they needed to be seen. So I guess that's kind of like the difference here compared to like a third world country compared to a first world country like Japan. They also had really great facilities, like in their OPD. Each OPD room had their own ultrasound uh, machine, like this, had their own ultrasound and ECG machine in every OPD room. Because supplies are always complete. Um, I guess it's just really nice that way. So, and basically, any patient could get a quick ultrasound. Any patient could get a quick ECG. Um, um, uh, as well as their endoscopy units were really well maintained. They're super clean. Oh, and also, I guess another thing that's really fun there was that they would have like 50 to 100 endoscopies every morning. Like by 10 a.m. they would have done around that much endoscopy. That's how much endoscopies they would have there because uh, I'm sure you guys know that like Japan is known to have high prevalence of gastric cancer. So, they have gastric problems more than cardiovascular problems. So I guess endoscopies there left and right. But that's another thing I experienced there as well. Um, yeah, I guess because of that experience of that kind of healthcare situation they had in Japan, I do have an idea of what the Philippines could somewhat strive for. Uh, kind of like set a standard in my head that ideally we could hopefully one day provide this kind of care for the Filipino people. So it didn't help me so much like academically, but as a doctor and as you guys know, being a doctor, a five-star position would also include um, someone who helps the community, being a leader and such. It helps you set a goal for you and yourself and for the people around you, the patients that you treat. You hope that you could give them the ideal management. And it's nice to see what the ideal management could look like. Um, because if you're always in a situation where you have to adjust to the not ideal management, which is probably majority of our fellow healthcare workers are in. Sadly, you could get desensitized and you could lose your way and you could just get used to it. That this is how it is. You know, that this is what we have and this is how it's always going to be and there's nothing else that we could do about it. Maybe that could be true to a certain extent. But at least by experiencing what it's like somewhere where they have the ideal situation, you could somewhat strive for it. It could be somewhat like a dream for you to lift you guys up, to lift us up, to something to strive for. I think that's the biggest impact it had on me. So I forgot to mention one big challenge I had by going abroad for my exchange for a month during my clerkship was I missed out on a couple of rotations that were happening in the Philippines, no, with the rest of my classmates. Um, I missed out on my radiology rotation and my rehab rotation, which was a pretty big deal for me also. So I do feel bad by missing out on those because um, I never, like my classmates, they had somewhat they had somewhat of an experience learning from the radiologist how to look at chest X-rays, CT scans, and MRIs better. But I never got that one-on-one experience as a clerk, and I kind of need that. I needed that entering residency. I wish I had more of that background But because I missed out on those rotations, um, well, I had to kind of learn it on my own. I kind of had to take baby steps. In fact, I had some interns look at chest X-rays with me as a resident. And I thought that the interns read the X-rays better than me sometimes, because I felt I was not proficient. I did not experience these things as a clerk. So yeah, if you're willing to miss out on a couple of rotations, um, then I guess it's okay. Especially if you don't need like maybe radiology or rehab in your future career, then it's fine. But that's something that I had to give up, for going abroad for sure. That's something you guys should also keep in mind before applying. Okay, I think that's the last message I have.
Thank you for that, Doc. But how are you with these skills po right now? Were you able to learn them
Uh,
during your
yeah, I had to learn them on my own slowly. I still don't feel confident, like as confident as I hope to be, reading X-rays, etc. I mean, I have a good idea, but I'm not confident. Um, I would still consult a lot with the radiology department on readings, but syempre, I wish I had the background, like something like a more solid background to base off from, rather than just um taking the baby steps on my own. And syempre, as a mas nakakaya as a resident, because at that point they would expect you to have more of a understanding or a better clinical eye for reading X-rays already at that time. Syempre, as a clerk, you can be as dumb as you want. You can be as blind, entering the situations as blind as you want, because you're not expected to really know. It's expected to really be your first time, and that you're expected to just learn. So yeah, I missed out on that. Which is, wala, yun talaga. There's always a give and take, a pro and con by doing these things.
I agree, Doc. And I think learning is a lifelong process and it doesn't end from after you finish your training as a clerk or maybe even after residency. Learning will always continue and there will always be opportunities out there. All you have to do is to take them. So, well, I guess, Doc, this ends the our podcast for today. And we would like to thank you again for attending.
Yeah, thank you for inviting me. Yeah, I'm always happy to come back to AMSA as long as you guys need me.
All right, so this episode has truly been fruitful, and for sure, all of our listeners have gained so much knowledge on the past Scope exchanges, such as the application process, but most especially all about the learnings that we gain from exchanges and things such as independence and even a different perspective on healthcare. And thank you very much to our guest speaker, Dr. King, for your time with us, for sharing your experience. And thank you to all our listeners. So please feel free to click on the link below to let us know your thoughts on this episode. And once again, this is XPod 2023 to exchanges and beyond.